I want to also relate to what Reuven said before in terms of responsibility, because that I found very inspiring. I think that was a very important message, that at the end of the day, each of us is responsible. So when I come more from a government perspective, which is you're responsible for this, you're responsible for this, you're responsible for this, I'm responsible for this, you kind of gave me a different way of thinking of it, about it, which is that each of us is responsible, and it's not a question of dividing responsibility, but a question of somehow shared responsibility. So that's that. As kind of the official, formal Ministry of Health representative, this is the one that I really am most I can really I feel most strongly about, which is that based on well-established importance of physical activity and social interaction for kids, governments and professional organizations need to encourage parents to restrict screen time, including wireless devices. That is, I don't think there's much debate about that, and I think that that's a very strong message. We'll talk in a minute about the issues of radiation and the possible effects, the potential effects, the likely effects. This is kind of a no-brainer. This is very well proven.
But I want to point out that children, although they may have immediate health effects, they may well accumulate exposure, which eventually gives them adverse health effects as an adult. We cannot ignore the fact that not only must we do this in terms of policy options, but we've got to have policy options in terms of the adult community. The adults who, in terms of the studies we've done now, have already been demonstrated to develop cancer. And there's signs, as I hope will come out in our epidemiology working group report from some of the case theories, that it's not just restricted to brain cancer and vestibular schwannoma, but possibly hemolymphatic cancers, testicular cancer, and whatever. And maybe all cancers could be increased with the Internet of Things and the vast exposure that's going on now. So let's make sure that that also comes up front. So it's not just children and parents we're directing this to, it's governments and responsible for health for everybody.
A campaign is one part of a program. It's not enough to have the campaign. It's a program which includes legislation and supervision and
education.
And education. It's part.
Okay. But government ministries should better coordinate and collaborate, meet regularly to address this issue. Again, this is because this is an issue that tends to be divided between responsibility between the Ministry of Health, Environment, Communications, Education, and so we need to, in Israel, I think it would definitely make sense to have sort of a forum to work on this together, assuming that we're not going to get any legal changes to divide, so we have overlapping responsibilities. So we need government ministries to work better together to coordinate.
An institute.
Public should be informed about radiation exposure and regular measurements. So this is not only from cellular radiation, but it could also be from EMF, from electrical fields. And then this is what Richard Lasser talked about this morning, introduction of new technologies and somehow proceeding through a similar a REACH process. If we have REACH for chemicals, thinking of a REACH process for technologies as well. And then this talks about what you were discussing earlier. Guidelines need to be strengthened to protect the public and children, reflect current use patterns, adequate protection from non-thermal effects. I think